I will tell you, I was probably like 90% of the rest of the people didn't really think it existed that much in Lawrence County. You know, really think, oh, that doesn't happen here, or maybe it's just isolated cases here and there. But the more involved you get, the more you realize that it's, you know, it's everywhere.
You know, by the time a child is 4 years old, 25% of those kids experience a traumatic event. So when those traumatic events build up on each other, you end up with all kinds of mental health issues, behavioral health issues. We have kids who become suicidal, depression, anxiety, all those kinds of things that interfere with the learning process and from them becoming productive citizens.
Research shows that once you've had some trauma or disruption, whether it's drug and alcohol abuse, domestic violence, you know, sexual assault, whatever those kinds of trauma might be, your brain starts to get rewired.
By age 3, children have 80% of the brain already formed. By age 5, it's 95%.
So Lawrence County is a very depressed area, very economically depressed. What we see are families that are really struggling.
It is a challenging environment for kids to grow up in, and I use that word challenging as you know, a politically correct or perhaps a less intense choice of a word.
I think family as a whole, as far as you know, in our day and age, it's a whole lot different from when I was raised up, where you had a mother and father there and a tight family unit. Well, today we live in a society where many kids are coming from broken homes and they're lost. They don't have the proper education or instruction that they're receiving. And so a lot of kids are really left to themselves. And I think that's the problem, that a lot of times adults feel like kids can handle it. Well, they're 5 and 6 and you can go down the street and play with Johnny.
Probably the more accurate description is it's extremely difficult for young kids to grow up when they don't have a family support system, when they are not regular attendees in schools, they have no consistency within their own lives, and they are living in a depressed economic community.
But what you also need to know is that this child sexual abuse, physical abuse happens across every socioeconomic area of our counties. We saw there was a gap in services to children who were disclosing abuse. There was not a coordinated system for these kids, and there was a group of people in Lawrence County that saw that need. And so they went looking for a model program, and they found the Children's Advocacy Center in Huntsville, Alabama.
And we have our multidisciplinary team that is composed of anyone and everyone who may have something to do with the case, so that you try to eliminate as much trauma for the child as possible.
What it does is it allows children to disclose one time to professionals who need to hear their story, mainly investigators, so that they can hear that child one time and then act on that interview and begin their investigation. It really saves the child from being able to tell their story over and over again.
The multidisciplinary team is single-handedly one of the most effective units or groups of people in our community, and what they really do is they pull together a variety of subject matter experts from various social service agencies within the community, including law enforcement agencies. They bring them all into the same room and we roundtable existing cases.
What we see now with the coordinated effort of the team, meaning the district attorney is on board, Children and Youth Services is on board, and our other team members, we have probably a 90% prosecution rate of children that we recommend to the district attorney's office for prosecution. So that coordinated team effort where we get together on a monthly basis has really made a change in the conversations that happen about kids.
The Child Advocacy Center is a leader within the multidisciplinary team.
Multidisciplinary team identified this as a need in our community. So nobody really in Lawrence County was doing trauma-based therapy. So there would be a need for it, and then our families were referred to out of county to like Pittsburgh. Our families can't get to Pittsburgh. There's transportation issues. There's just no way that they could get to Allegheny County. So now the Children's Advocacy Center has started this very new program.
You know, the aftercare that has to go on with these kids in programs later into their teen years, if we can avoid doing that and getting to kids early, taking care of their trauma early, we're going to save kids in the long run from dealing with some of the issues that they have to deal with when it goes untreated.
A lot of our families don't just experience one traumatic incident. There's, trauma after trauma after trauma, which causes toxic stress, which the cortisol levels in the brain and your body increase. So if your body is always in a state of anxiety and that cortisol is always up, it inhibits the connections in your brain from allowing you the cognitive development. So we're hoping that through the therapy, you're going to bring down those stress levels and the cortisol level, allowing that child to develop on target and healthy.
I think once we got the intervention services down and we knew how to deliver that here in the county, we wanted to take a look at how could we prevent child abuse from happening, in particular the serious neglect and the child physical abuse.
I think these programs are absolutely necessary because a lot of today parents are just not equipped. And really these essential programs they have, the fatherhood program, they're absolutely essential because if you don't know what to do, then you'll do anything or you won't do nothing at all.
We're the only ones in Lawrence County who are delivering this early prevention services for kids. We're it. I think that what we see with some families is that they've never had this behavior modeled for them.
I would agree that the nurses play a big part in helping these girls be successful, and that is some of these girls have not had the role models in their lives that maybe you and I have had, and so that means they haven't had an opportunity to see how to really nurture and support that baby's development.
You're actually teaching them how to be responsible, productive community members. It goes far beyond, just the situation that started them into the agency. And it's because of the staff, and their compassion and their commitment, to their clients that they can do that.
The nurse shows up time after time, whereas maybe nobody else in their life has ever shown up for them before. And that's what makes it such a special, unique, strong bond for them.
There is this thing called attachment theory. And simply put, what that means is children at a very early age learn to trust adults because of the care that they are given by that caregiver or adult.
If you're attached with your child, then that means that you can begin to develop trust with your child. And if you can develop trust, that's one of the foundations of any relationship, and that's one of the building blocks of any relationship. And so if we can get that attachment, then we can start to have, healthy future generations.
And so what we're trying to do is help to begin to instill some of those things and help parents to realize that their kids can go beyond what they've done. And we try to give them those seeds and that encouragement to be able to do that. But many of them truly haven't had anyone coaching them, helping them to learn what are the right ways to teach your children and to raise your children. So we're being that surrogate parent and helping them to learn that.
I always say that we're the best kept secret in Lawrence County. We are completely a grant-funded agency, and that is probably our biggest challenge is, finding the grants, finding match money. The affiliation with Jameson has been good for us because they have provided the match money that we have needed over the years.
Children's Advocacy Center has done is to really be thoughtful about the kind of programs that it brings in. We're only doing evidence-based and research-based programs, so there are outcome measures that say these programs work. And so we have really committed ourselves to only doing that kind of programming so that there is the data to back up that what we're doing makes a difference in the community. And it's just not touchy-feely kinds of things. It's actually evidence-based, research-based data that drives these projects.